slide number 6. It's odontogenic keratocyst. Here you should يعني نحن نحتاج هون شوية دقة. Odontogenic keratocyst, it's the most dangerous or the most complicated cyst in this family. Treatment is a little bit difficult and aggressive. It has a lot of complications. Surgery is difficult. We need, when diagnosed, we need an efficient maxillofacial surgeon to remove it, because any bits of this, if not removed effectively, it will cause recurrence. That's why we have two types of odontogenic keratocysts. We have orthokeratinized, we have parakeratinized. It's you should, when doing this surgery, we need a team from a good maxillofacial surgeon and a good oral pathologist to give good prognosis for this patient. It's يعني ايش نقول، السيست هو هذا نحس او the first thing sometimes it could be recognized by chance. يعني ليش؟ The patient went to the doctor for some dentist for some type of clinical dental procedure. The dentist took an X-ray, saw the radiolucency. This cyst does not enlarge by expanding the bone. It moves within the bone marrow. That's why the patient will not complain from growth of a lesion. ما مثل الاميلوبلاستوما. اميلوبلاستوما تتذكرون الديفينيشن مالتها slowly growing locally aggressive. يبقى enlargement it's painless, no pain, no anything, but it keeps enlarging الى ان مرات البيشنت يجي على الدنتست كن وصل مرحله انه he cannot eat or swallow، وسبب عدم المراجعه اما خوف او كسل او there is not يعني معظم البيشنات يجونا because of pain. There is no pain. Odontogenic keratosis, there is no pain, there is no destruction لل surrounding teeth. ال lesion is very aggressive and fast. when it grows and reaches the roots of the molar or premolar, it does not cause them to يعني ما يظل يعمل pressure على الروت until it will resorb. No, it escapes the roots and goes يروح على الأسهل طريقة اللي هي inside the bone marrow. ولهذا there is no dislocation of the teeth, there is no resorption of the roots, the occlusion تقريبا stays normal, and if diagnosed early, the prognosis will be better. If diagnosed late حرامات sometimes occupationات complete mandible، يعني الماندبل كلها تنشال وواحد يتخيل نفسه without a mandible. It's very difficult. وسبحان الله كن شفنا كيسات انه they remove all of the mandible because of this cyst, odontogenic keratocyst. If I have two types of keratin, I have if orthokeratinized diagnosis, removal of the cyst will be less aggressive. If parakeratinized, the removal of the cyst should be more aggressive because it's liable to recur a lot. Parakeratinized is more aggressive than the orthokeratinized. If it is both، واكو تقريبا حالات 35% شافوا كيسات انه it has both orthokeratinized و parakeratinized types of epithelium، بهالحالة السيرجن لازم يتحول إلى جماعة يعتقدوا parakeratinized ويبدي يشتغل. Sometimes if you can see this clinical picture, you see keratin that is excluded from the lesion. ايش تلاحظون؟ أول شيء this ridge alveolar ridge is edentulous. إيش معناتها؟ أكو احتمال إنه البيشنت كان عنده radiolucency، الدنتست thought it was a kind of periapical lesion أو شيء، وظلوا يشلعون أسنانه ويا الأسنان ما لها أي علاقة. الشغلة inside the ridge, inside يعني it's a developmental type of problem. As you can see, the alveolar ridge is not يعني enlarge a lot، قليل الانلارجمنت ماله، فمعناته الروت of increasing or الجروث مالته لهذا السيست is within the most easiest route اللي هو البون مارو. That's why we see it كأنما it's multilocular because it's يعني the growth goes within the bone marrow. The epithelium is very weak, liable to tear. That's why surgeons, when they treat this type of lesion, they try to completely remove all the location that is related to it. تريتمنت جماعة السيرجري هي ما راح يعني يحاولون، بس هسه اكو يعني advanced treatment that are reducing this aggressiveness of surgery. But it's a dangerous cyst. You should بالdifferential diagnosis you should include it. إنه if I have a radiolucency خاصة بالposterior of the mandible، أخلي ببالي odontogenic keratosis could be a differential diagnosis related or not related to a tooth. It could يعني it could one of the causes يعني of this lesion is odontogenic keratosis, radiolucency in the alveolar bone. الراديوغرافيك فيتشرز حكينا multilocular، قلنا why because الجروث مالته very fast. As you can see in this radiograph, the roots are normal. There is no resorption, no dislocation. ماكو شيء يدفع الteeth because when the lesion or this odontogenic keratosis reaches the root, it does not tend to dislocate it. يعبغ الروت يروح يبقى يظل يدخل inside the bone marrow والgrowth مالته is very aggressive. That's why it's one of يعني اكو جدول بالكتاب يعمل مناظرة بين العلماء اللي يقولون this is a cyst والعلماء اللي يقولون this is a neoplasm. You know what's a neoplasm.